This is Stephen Carter with Texas-Cannabis Report. I'm here with Heather Fazio for Texans for Responsible Marijuana Policy. Heather, could you tell us a little bit about your organization?
Sure. Well, I work with the Marijuana Policy Project. We're just one of many organizations working with the coalition, Texans for Responsible Marijuana Policy. Our website is texasmarijuanapolicy.org for those who want to check that out. The coalition is bringing together a diverse spectrum of Texans who want to see marijuana laws reformed, whether it's for fiscal reasons, if you're lean more conservative, or if you're more Democratic leaning and you're interested for the social justice reasons. People across the state of Texas are ready for marijuana law reform.
I understand that your group is shopping a bill in the legislature. Could you tell us about that?
Well, there's actually two bills that we're going to be working on this legislative session as priorities. The first of which is HB 507, which has already been introduced by Representative Joe Moody. He's a Democrat from El Paso who is a former prosecutor, so he knows the ins and outs of how marijuana prohibition is affecting our communities. And his bill decriminalizes the penalty for possession of 1 ounce or less, which means that a person is not going to be arrested, they're not going to be taken to jail, and they're not going to have a criminal record which follows them for life for the simple possession of a small amount of marijuana. A personal amount is what we're looking at, 1 ounce or under, which ends up being about a pack and a half of cigarettes when they're rolled. The other bill that we're prioritizing is medical marijuana in Texas. This is a program similar to what 23 states have across the U.S., which accounts for 47% of Americans have safe and legal access to medical marijuana. So our program would allow patients to register with the state so that they're free of arrest if they are pulled over with up to 2.5 ounces of medicine is what it would be for them. And then it also establishes cannabis businesses. So we'd have dispensaries, cultivation centers, which is our Texas agriculture. We'd also have manufacturers to create the infused products that many patients prefer to consume rather than smoking, because smoking is invasive, but there's so many ways that you can consume the natural and therapeutic benefits of cannabis. Mm-hmm. And then finally, laboratories, which are one of the most important elements so that we know exactly what we're getting. We know the different levels of the compounds that are in the different strains of cannabis, and also making sure that it's contaminant free, which is very important for those who are sick.
Well, people do have a lot of questions about this medical marijuana bill, such as who will it cover?
Well, we are working to have a very tightly regulated medical marijuana program, which would have strict qualifying conditions in the program. So we're talking about those suffering from PTSD, like our veterans who are returning home, those suffering from cancer, which causes wasting and loss of appetite. Well, cannabis has been proven to help them through the process of chemotherapy as they suffer through cancer and hopefully recover. Glaucoma is one of the diseases that cannabis has been proven to help. AIDS and HIV is included. Also digestive disorders like Crohn's disease and ulcerative colitis. We've seen tremendous strides in medicine with the use of cannabis for patients who are suffering because it's an inflammatory disease, and they're able to actually keep food down so that they don't end up wasting away, and they're able to see relief. It also includes seizure disorders. We've seen over and over again stories like little Alexis Bortel up in North Texas who suffers from epilepsy and needs this natural medicine because pharmaceutical drugs are not working for her and they cause so many harmful side effects. Mm-hmm.
Well, a lot of patients do have questions such as, will patients be able to grow marijuana at their home? Mm-hmm.
Well, what we'd like to do is allow patients to grow their own medicine. Not only does this help them to be able to, be completely sustainable with this natural herb that they are able to grow that grows well in Texas, but it also is therapeutic for a lot of folks who are homebound to be able to grow and grow this herb and be connected to the medicine that is helping them to live.
Some people do wonder what happens if 2 or 3 patients get caught with the legal maximum on their person at a time. How does law enforcement sort that out?
The possession of cannabis is going to be treated similar to other controlled substances. So when you get your medicine from a dispensary, it'll be labeled for you, and it'll be in that in a container that has your name on it, and that you're going to be able to verify with law enforcement that you are a patient and that this medicine is actually yours. So while there may be 3 patients who exceed the limit of 1 person in the car, if it's all labeled properly, which is what we intend to do with this very tightly regulated program, this legitimate program program that's been working in other states, they're going to be safe from fear of arrest.
Now, speaking of proper amounts, as you know, tinctures, edibles, oils, stuff like that is more concentrated. How will that be handled?
Yeah. Currently in Texas, it's incredibly harsh and unfair with concentrates. It's a felony when it's been concentrated. And with our medical marijuana program, concentrates and tinctures would be included in as well as other infused products. You know, as I was mentioning earlier, many patients don't like to smoke. It's a very invasive way to consume the product. And while some people do prefer to do that, and smoking does have benefits as far as immediate relief, especially if somebody is suffering from a seizure, if they can take one puff and be able to see relief immediately, that's incredible. Of course, vaporizers also allow more of a clean a way of inhaling the medicine. But tinctures and concentrates absolutely will be included because there's so many different ways for a patient to receive the medical benefits of marijuana.
Some patients will end up need to medicate from away from home. How will public medication be handled?
Can you restate that?
Like, will patients be able to smoke their medicine in public or ingest it in other ways?
Well, smoking certainly is not going to be legal in public. That is not really something that's going to be discussed very much. That's going to be kind of across the board. Smoking cannabis in public is not going to be acceptable. But just like with all medicines, medicines are expected, patients are expected to consume their medicines responsibly. So just like you would be able to have, if you have a pain medication or an anti-anxiety medication, you're able to use that publicly as long as it's not interfering with public safety or hurting others.
Would you consider vaporization to be extremely different than smoking?
Vaporization is certainly different than smoking as far as the medical side of things. Inhalation is a very quick way to receive the immediate benefits of the plant, and it's much cleaner and healthier for you than smoking, but that will not be something that is allowed to be done in public.
There are concerns about patients taking their medicine and then driving down the road. How will that have an effect on public safety?
Well, just like it is today, driving while under the influence is not legal. It is not legal to drive while you're impaired on a prescription drug. This is going to be considered just like a prescription drug, and you're not allowed to drive while you're under the influence. It's a public safety issue, and we're not trying to change any of the driving while impaired laws.
How will police be able to tell whether or not a person is impaired?
That is a very interesting thing that is being developed on how right now, driving under the influence is illegal, and they arrest people for doing so when it's obvious and when there's evidence against it. Now, what's hard is a conviction because unlike alcohol, there's no blood alcohol content, so there's no cannabis content in your blood that determines whether or not you're impaired at that moment. You could have smoked a week ago or consumed a week ago, and it would still be in your system. But technology and the market is working because there's a demand for it. The market supplies what we need and what there's a demand for, and there certainly is that. And technology is catching up with the times to determine whether or not someone is impaired while driving.
Will patients from other states be included in this program, or will patients from other states be able to bring their medicine to Texas to consume?
Yeah. Well, we do plan on having a reciprocity clause, which means that anybody that has a qualifying condition that is within our program from another state, they will be able to purchase cannabis from a dispensary here in Texas. They would have to apply with the state in advance, and they would have to get their ducks in a row in advance of their trip. But transferring cannabis from one state to another is still illegal under federal law. You can't cross boundaries. But we do want to make sure that patients from other states are welcome here in the state of Texas, and we want them to feel comfortable and to have relief from whatever their conditions are while they visit the great state of Texas. So we want to make sure that they're able to get their medicine from Texas dispensaries.
Will those patients have to see a Texas doctor in order to be approved?
No, if they have a qualifying condition and are an approved registered patient in that state that has a medical marijuana program, they will be qualified here in Texas.
Getting back to the business side of things, will people be able to have their medicine delivered to their home?
Absolutely. Within the program that we're trying to institute here in Texas, dispensaries would be able to deliver to patients, which helps if you don't have a caretaker on hand and you're not able to drive yourself. You can have that medicine delivered, similar to other medications. There are companies that do delivery for them.
One of the biggest questions looming on everyone's mind is, if I get approved for medical marijuana and I consume it, can my employer fire me over that?
Employers are going to be required to treat the medical use of cannabis similar to the medical use of any other drugs. When it comes to consuming marijuana on the clock or on their grounds, they're not required to allow you to do that. But if you use it off a site at home responsibly, and it comes up in a urine analysis, they cannot fire you over that, just like they couldn't fire you over a prescription to hydrocodone, which is a controlled substance. But when you have a prescription, or in our case with cannabis, a recommendation, and you're a qualified patient, you are protected then.
Okay, well, thank you, Heather, for your time.
Yes, thank you very much for the opportunity. Keep up the great work.
We appreciate it.
Thank you.